All of the residents we are privileged to care for have the right to make their own healthcare decisions. These decisions are critical for people with serious advanced illnesses, and it's important for us to discuss treatment decisions with these residents and their identified family members. The Louisiana Physician Orders for Scope of Treatment document, also known as LaPOST, is designed to help these individuals translate their end-of-life medical treatment decisions into actionable physician's orders that must be honored by healthcare professionals involved in their care. I'm Dr. Susan Nelson, and in this program I'll talk about LaPOST with several long-term care professionals. To begin the discussion, LaPOST may be appropriate for many residents, but it isn't appropriate for all residents. Completion of this important physician order is always voluntary. So who would benefit from having a LaPOST document?
Medical appropriateness in the long-term care setting for LaPOST really is decided by a case-by-case basis. They do have to be determined to be very medically ill or frail, and some of the diseases could be ALS, dementia, congestive heart failure, end-of-life situations.
Anyone who has a life-limiting illness that you wouldn't be surprised who would die within 6 months. Those are ones that are appropriate for LaPOST. They've had a change in condition as well.
LaPOST document in a long-term care setting is always voluntary, never to be mandatory for any resident.
The LaPOST document is not used for code status document. It only just complements their living will that they have.
If a resident is appropriate for a LaPOST document based on his or her prognosis, it's very important to encourage the individual and family to have a meaningful conversation with the resident's physician about LaPOST. What are some of the key points that should be covered in this discussion?
To approach a patient about LaPOST, you'd start with maybe looking at their medical record and their history, looking for some changes. Talking to the resident themselves and getting the family involved is the key component of starting that conversation about a LaPOST.
The main thing for the LaPOST document is that it is a physician order for this scope of treatment. It is not a code status, it is not a determination, but definitely it would include their treatment care, their goals of care for the end of life, but it is a physician order. The resident can select different treatments on the LaPOST document. There is full treatment where everything is done. There is selective treatment following the processes of their diseases, and then there is comfort care measures that would be given to the resident that is followed with them through their disease states.
The document can travel with the patient to the hospital, back to the residency. It travels with them as part of their health record.
The LaPOST document can be changed at any time by the resident or discussions with the physician by the family, and then it would become a new physician order, whatever changes were made on there.
Completed LaPOST documents represent the resident's current wishes about medical treatments they would like to receive or not receive based on their current condition. Because they have a life-limiting, irreversible illness, their condition is unlikely to improve, but rather decline. As a result, LaPOST documents should be reviewed regularly.
The resident should have their LaPOST document reviewed whenever there's a change in the healthcare setting, whenever there is a change in their care plan, in their health status.
Also, whenever the resident would want to have another review. It's whatever their goals and wishes that they need to talk to their physician about. Also at quarterly care plan meetings, they should be also reviewed at that time.
The LaPOST document is the first statewide uniform physician order that is recognized across care settings. Document portability and accessibility are essential to maintaining continuity of care for the residents as they transfer between settings and during transport. To achieve this, all links in the healthcare continuum must understand and support the use of LaPOST.
A lot of education goes into making sure that our staff members know about LaPOST document, and also educating our family members and residents as well.
One of the main things with the LaPOST document is we have to know where this document is kept, and it has to be kept within the electronic medical record if that's what the facility has, or it needs to be kept as a paper document in the resident's record. And the staff needs to know where this is at so it can follow them to any healthcare setting, even the ER, the hospital, where they would go.
To further support document portability and accessibility, long-term care facilities also need to work closely with community partners such as emergency medical service personnel, local hospital emergency departments, and home health and hospice groups, among others. Our last topic involves monitoring and evaluating your facility's LaPOST implementation. Regularly reviewing this process helps to strengthen the document's use as a powerful tool for stating and honoring the treatment wishes of seriously ill or frail residents. Your evaluation may take the form of a retrospective chart audit that compares actual treatment provided to residents with their stated treatment preferences on the LaPOST document. It can also include questioning the basic structure and processes of your facility's implementation. Regular evaluation can support and enhance your facility's quality assurance and performance improvement approach to LaPOST.
For our staff members to understand about LaPOST, it takes a lot of training because with a LaPOST document, you really are focused on patient-centered care. That starts with, at the beginning, whenever you're first hired, to introduce that into your orientation so that your staff members are understanding about what a LaPOST document is, if they ever have to have that conversation. Also, getting your social workers involved, too, is a very key to having those conversations as well.
It is very important for residents and families to understand LaPOST. It is important for staff to take the time to talk with the resident or the family and make sure that they have a true understanding of what the LaPOST is, the treatment goes, and what this is about and how it affects them.
Policies are very important to have those in place, whether you're updating those policies for your LaPOST, keeping those up to date, and also educating your staff members on those changes of your policy in place.
I hope we've provided you with key highlights related to the LaPOST program that will help fine-tune implementation in your facility. In closing, completion of the LaPOST document aims to ensure that residents' end-of-life treatment preferences and goals of care are thoroughly explored, properly documented, and appropriately followed. For more detailed information, please refer to the Long-Term Care Facility Toolkit by visiting our website at la-post.org. Thank you for watching.